Assalamualaikum warahmatullahi wabarakatuh. My name is Wardawaira binti Abdul Hamid and my metric number is 264473. Alright, today I will be presenting to you about my comments on 3 issues that have been given to me based on the link. Okay, the first issue is regarding the impacts of COVID-19 to the tourism industry in Malaysia. The COVID-19 was first reported in December 2019 in China before widespread throughout the world. The pandemic is highly impacting the tourism industry in Malaysia, particularly the airline businesses and the hotel businesses. In Malaysia, the first COVID-19 case was confirmed on 25th January 2020, which involved 3 Chinese citizens that entered Johor Bahru, Malaysia via Singapore on 23rd January 2020. From a total population of 32 million, Malaysia reported 6,002 COVID-19 infection cases with 102 deaths as per end of April. Subsequently, the seriousness of this virus has led the World Health Organization declared that the COVID-19 outbreak to be a global health emergency of international concern on 30 January 2020. Alright, COVID-19 has exposed major risks to visit Malaysia 2020, a campaign as 50% of Malaysia's tourists are originate from Singapore and China. The increasing cases of COVID-19 in both countries has led to the cancellation of many tours, which has already led to a large drop in the number of tourists to Malaysia. Airline industry players has highlighted that the current travel bans and plummeting demand around the world have put the loss-making carrier at risk of bankruptcy. All 3 Malaysia's major airlines, namely AirAsia, Malindo Air and Malaysia Airlines, have initiated salary cut range from 10% to 100% and unpaid leave depending on the salary range and position. Nevertheless, the airline industry faced its gravest crisis when the government of China denied entry of foreigners effective from 29 March 2020 until further notice. As per end of 22nd May 2020, foreigners are currently not allowed to enter the country. A total of 170,084 hotel room bookings during the period of 11 January 2020 until 16 March 2020 had been cancelled, which caused a loss of revenue amounting to 68,190,364 ringgit Malaysia. The loss was directly attributable to the outbreak of COVID-19. From what I've read and researched before about the impacts on the tourism industry in 3 different countries, which is China, America and Italy, they all led to the loss of countries' GDP as the situation itself was not allowing anyone to be in a place that forced them to make any social contacts in order to prevent the virus from spreading. And that is why the economic sector of the countries have been in vain, because the virus spread forced them to keep themselves locked in their houses. This led to no tourism allowed during the pandemic because the activities will help in increasing the spreading of the virus. Alright, for the second issue is that regarding the tourism policies or planning strategies that Malaysia should do in order to prepare for a similar situation to COVID-19 in the future. Alright, the non-governmental organizations as well as prison inmates started to produce personal protective equipment for frontliners. Various organizations hosted fundraising events to provide essentials mainly to hospitals. A provisional hospital was set up and collaboration with healthcare service providers were granted, while additional laboratories were assigned to enhance the capabilities of the Ministry of Health. Among the first earliest efforts taken by the Ministry of Health to prevent disease transmission was the enforcement of health screening at all points of entry. According to the Director General of the Ministry of Health, Dr. Nur Hisham Abdullah, one of the strategies was the placement of thermal scanners. This was done to further enhance the detection of fever amongst tourists and locals returning from abroad. Malaysians who returned from Wuhan were screened, identified, and isolated in special quarantine areas for COVID-19. This measure also involved airline crews as well as the staff of the Ministry of Health. The step taken by the Ministry of Health along with the government to overcome cases such as COVID-19 in the future was to increase the number of hospitals that could treat such as the COVID-19 cases. There was also a group effort between the public and private hospitals to accommodate the growing numbers of cases of infection, comprising university hospitals and Ministry of Defense hospitals. Alright, another measure taken by the Ministry of Health was the setting up of a special fund to raise money to be channeled to patients, particularly those affected financially due to the quarantine procedures. Through this fund, 100 ringgit was given daily to those who had no source of income throughout the quarantine and treatment processes. In addition, the money collected was used to cover the medical expenses such as buying crucial equipment and other supplies. The Ministry of Health, in its effort to counter any COVID-19 cases in the future, set up a provisional hospital in the Agro Exposition Park Serdang MAEPS in coordination with the National Disaster Management Agency. This makeshift hospital, which was initially Malaysia's largest convention center, is equipped with computers, televisions, Wi-Fi connection, a lounge area, and some other basic facilities for use by patients and medical staff. This hospital is to be used as a quarantine and treatment center for low-risk patients, and 604 beds have been prepared to cater for confirmed cases. One of the initiatives agreed after the Economic Action Council meeting held on March 23, 2020 was the allocation of 600 million ringgit Malaysia to the Ministry of Health to battle with the cases such as COVID-19 in the future. According to Prime Minister Tan Sri Muhyiddin Yassin, 500 million ringgit Malaysia will be utilized to buy ventilators and personal protective equipment, and another 100 million ringgit will be used to appoint 2,000 nurses on a contract basis. In addition, the Ministry of Health arranged various disinfection activities to be conducted by the Ministry of Housing and Local Government, local authorities, and the DBKL Kuala Lumpur City Council. And the Ministry of Health also sought to be transparent in handling the pandemic by providing sufficient and up-to-date information to the public through 3 major platforms, including the official portal of Ministry of Health, creation of a special Facebook user account called the Crisis Preparedness and Response Center (CRPC), Kementerian Kesihatan Malaysia (KKM), and CRPC KMM Telegram. Alright, for the last issue is regarding the personal experience of the students during the Movement Control Order (MCO). Alright, me myself, during the MCO, my family and I have been less in visiting the supermarket. Only when the foods have finished or the groceries needed were in the lowest amount, then we will go to the supermarket for filling up the kitchen. Before we go to get the groceries, we have to wear a face mask in order to prevent ourselves from getting the infection outside of our home. And as we arrived at the supermarket, we have to be in a long line at the entrance to check our body temperature and have our hands sanitized before entering. We have to remain our social distancing in the line for about 1 meter apart from the people in front of us and behind us. Although it took a long time to just to enter the supermarket, we understand that it is needed to be done to prevent the virus from spreading widely. After we got ourselves checked, we have been given a pass as a sign that we were allowed to enter the supermarket. And we were also given only 15 minutes to be in the supermarket, so we have to hurry to find the things that we need. In the supermarket, we also have to remain our social distancing. After we quickly grabbed the things needed, we have to line up at the counter and pay for the things, but we still kept 1 meter apart from each other. After we were done, we have to give back the pass to the security in charge before exited the supermarket. When we arrived home, We put off and throw the face mask into the dustbin and clean our hands with soaps to prevent taking in the virus into our home and our family. Alright, so the conclusion that I can wrap over the things that I have conveyed before is that the importance of having a good surrounding and harmonious society in order to prevent any emergency related to the international concern is a blessing, because for example, from what I've read before about the impacts on the tourism industry in America, they have been struggling with numerous cases of COVID-19 in their country due to their lack of responsibility to themselves or to their surrounding. So that's all from me. Thank you.